All right. Okay. All right. I think we have it now. Gail, can everybody see the slides and hear me okay?
Yes.
All right. Well, first of all, thank you very much for having me here with you this evening. I won't take a lot of time tonight introducing myself and talking about me and kind of who I am and what I've done, but I decided that what I would like to share with you is just a little bit about my history with working with foster families. As Gail told you, and you can see, my name is Linda Waite. I am the section chief with the Division of Social Services with Regulatory and Licensing Services. I have had the privilege of working in partnership with foster families since the beginning of my child welfare career in 1987. And I know that was a long time ago. Some of you may not have even been born then, and some of you have probably been fostering since then. So I have been I started my career in child welfare with a foster care caseload. So at that time in my child welfare work, I was probably spending more time in foster families' homes than I was in my office. And I got to know some really incredible people during that time, and have always continued and carried a great deal of respect and admiration for foster families, for what foster families do to contribute to our society with very little recognition. And I've brought children to foster homes and foster families in the middle of the night, in the dead of the upstate New York State winters. And I've moved children from foster families under very difficult circumstances, and I'm sure some of you can relate to that as well. I've had the privilege of celebrating joyous occasions with foster families, weddings and births and all kinds of fabulous occasions. And I've also had the privilege of sharing in some really tragic situations with foster families and sharing in grief. I'm sure you can imagine, with all the years that I've been in this business, with the hundreds and hundreds of families that I've worked with, there have been, there've been situations where families have lost loved ones, spouses, people that I knew well, and we all. I think that people that don't work first hand close with foster families don't really have an appreciation of the kind of relationships that are developed. And those relationships are really very valuable to me. People that I'll never forget, going back all those many, many years. So I just say all that to have you know me in that way, rather than, like I said, some big discussion talk with you about my work and all that I've done in the field of child welfare for all these years, because really that is a big part of who I am and why I am and why I do the work that I do. So thank you. So with all that said, I will be sharing information with you tonight in my role as the section chief with the division about kind of where we are with several initiatives that join together, and one of the big drivers of our child welfare improvement and changes that are being made is the Family First Preservation Act. And the FFPSA is, you know, we have to always revert to our initials for all of the various and sundry things that we work with. So I'm going to start at the end and talk to you about FFPSA and some key takeaways about the Family First Prevention Services Act. And so the slide that you see here, what happens on October 1st, 2020, October 1st, 2021, rather. This is a big date for the Family First Prevention Services Act. On October 1st, the key provision of Family First is that happens on that date. And it happens all across the country, in every state in the United States of America. The 4E foster care funding, this is our federal funds that pays for a big chunk of foster care, the provision of foster care, will be limited for congregate care. And when we talk about congregate care, we talk about the residential child care programs that are provided for children to live in, not in foster homes, but in residential settings. And that limit will be for the first 14 days only. And then there will be no 4E funding after the first 14 days, except in the cases that are designated in the federal law for funding to continue. Also on how the federal funds are allocated with regard to Family First, effective October 1st in North Carolina, we will be able to use 4E funds for prevention services. And this is a big change that will be coming that incentivizes the prevention of children entering foster care, and also de-incentivizes the placement of children in congregate care. As you know, this is our system is a big system, and it takes time to make changes. It's complex, and this particular implementation includes the procurement of evidence-based programs, prevention programs that will be implemented in North Carolina, the option to use 4E funds for children in residential care through qualified residential treatment programs. That's one of the options that has been, that will be approved. The evaluation of the EBPs, the evidence-based prevention programs, the changes to the business process and payment systems, and also requires the use of Medicaid in the integration of the funds that will be used for the prevention services. Next slide, Gil. So just as we move forward in this presentation, I want to talk with you about where North Carolina is creating a comprehensive statewide array of services. This will be implemented across the entire state, but in our specific regions, and we'll talk a little bit more about that a little bit later. And then more specifics about the Family First Prevention Services Act and an update on where we are with implementation. Next, okay. So what will it take for North Carolina to create a comprehensive, accessible statewide service array that will result in the following? We want to create a service array that will result in families being supported so that children are less likely to come to the attention of Child Protective Services. That when there is a report on a family that alleges abuse or neglect, to provide services in assisting families to safely keep their children at home and not to enter the foster care system. That when children must enter the foster care system, that we provide services to help parents make changes safely and quickly to reunify with their children. And then, of course, when children cannot be reunified with their parents, to provide a system so that they can live with permanent families as quickly as possible through adoption or guardianship. So what does a comprehensive prevention plan look like? Well, we, and the child welfare section, are working with the safety, what we call the safety design team. This is one of 5 different design teams that work on different aspects of our comprehensive child welfare reform. The safety design team is tasked to look at all the areas of safety, and prevention and preventive services is one of those areas. By 2024, North Carolina will create a comprehensive framework to strengthen families and prevent maltreatment that will include prevention services, and that we will align with current department service array and family first prevention programs. So with regard to the integration of prevention services and child welfare, we want, again, to have one aligned comprehensive plan where we are looking at the needs of the families and ensuring that we have comprehensive services to meet an array of needs. You know, you all know, all families are not created equal. We all have different areas of where we have strengths and where we have needs. And what we want to do is ensure that statewide we have a system that addresses that wide array of needs. We want to be sure that we're serving children, youth, and families through an entire prevention continuum. And again, what that means is that some families might need just to be referred for maybe some additional medical services, and some might need a very intensive in-home family intervention to prevent children from being removed from the home to foster care. And we're the regional services, and again, the implementation of services in a regional manner is to better provide services statewide. And we have recently been approved to hire 7 regional system of care specialists, excuse me. And those regional system of care specialists will be responsible for the development of a regional network of community agencies that provide essential services for children and families served or at risk of entering the child welfare system. So basically what that means is that we are going to have a representative from the child welfare section in each one of the 7 regions that is going to be responsible for for coordinating this entire system of care. And Gail was mentioning to me just before we started the webinar that that FFA is also working in regions, and that is exactly how we want to partner with FFA and our other service providers and child welfare advocates, so that we are ensuring that, you know, for so long, there has been, we haven't been able as a state to really coordinate services statewide, and the whole process of regionalizing and creating regions where services will be regional, I believe, and the intent of it will be to improve the provision of services all across the state. This will also incorporate community partner and the parent voice, and also evidence-based implementation support and evaluation. All of these services strengthen and support families, reducing the risk of child maltreatment and entry into foster care. So this slide just shows you the map of the 7 regions across the state. As you can see, on this slide, the region 1 is the region in the far west with the far west counties, and then the regions are numbered as we move across the state over to region 7 in the far northeast section of the county. And this is, again, just an illustration of the 7 regions and how we will be implementing the child welfare across the state regionally. Okay, next slide, Gil. Recommendations to improve the well-being of children, youth, and families served by DSS. We receive these recommendations through a series of interactions with our stakeholders to increase availability to quality, accessible, and affordable mental health, domestic violence, and substance abuse services for children, youth, parents, and families involved in the child welfare system. To strengthen partnerships with the Division of Social Services, the Mental Health and Developmental Disability Substance Abuse Services, and the North Carolina Medicaid office, to make sure that behavioral health services are available to parents and to ensure appropriate placements for children in foster care. And I'm sure that some of you can recognize the importance of this with your interactions with both DSS and the mental health system. To collaborate with system partners to ensure that Medicaid transformation includes an infrastructure to meet the unique needs of children in foster care and their families, and to utilize the Family First Prevention Services funds to work toward a statewide array of funded services funded by child welfare, and to add to the continuum of services provided by other funding streams such as Medicaid. So we're really working to improve our partnerships with mental health and Medicaid to improve the availability of services across the board regionally, so that families are not, so that it's not so difficult. And we recognize that it has been quite difficult to access services, and we're working to overcome those barriers. So the Family First Prevention Services Act implementation with regard to the prevention services includes mental health services, includes services that address substance abuse disorder, in-home based parenting classes, in-home based parenting services, and the Kinship Navigator program, which provides an array of services to support families who are caring for kin in the foster care system. The evidence-based programs that have been chosen by North Carolina for implementation under the Family First Prevention Services Act are the Home Builders Model, Methadone Maintenance Program, the Multi-Systemic Therapy Program, which you have, I'm sure, heard referred to as MST. So MST forever is the Multi-Systemic Therapy Program. Parents as Teachers, again, PAT, we call that PAT often, but that's the Parents as Teachers Prevention Program. And then Triple P is also a parenting program, and Triple P has various levels of intervention. And again, I talked a little bit earlier about the different levels of intervention. Some families need a level 1 Triple P intervention, and some families need a level 4 Triple P intervention. And that Triple P level 4 is just a more intense kind of parenting program for folks who need to kind of start at a different place. Okay, next slide. So part of the foster family, or excuse me, the FFPSA is the requirement for the state to develop and submit to the federal government for approval the 4E prevention plan. If a state intends to use $40 federal funding for prevention services, then before any of that can actually occur, we have to write and submit for approval a prevention plan. And these bullets just talk about what has to be in the prevention plan, the state's vision of change, how we anticipate that the 4E prevention services will create positive outcomes for families, the eligibility process for candidates for foster care who are then eligible to receive the prevention services, to specify which prevention programs the state will use. And again, we use this acronym EBPs. The EBP stands for evidence-based programs, but what they really are the prevention programs that the state intends to use to seek 4E reimbursement for. The EBPs have to be approved by the federal government. AFC is the Administration of Children and Families. That's our federal oversight body. And the prevention programs have to appear on a list on the clearinghouse that has been established by ACF. We have to talk about how the state will maintain at least 50% of the total expenditures for the prevention program in the well-supported category. And again, this goes back to the EBPs and the fact that the prevention service that you're providing has to have been determined to be well supported, and that means that it is comes highly recommended, comes highly evaluated, and well supported at the federal level. We have to provide a detailed process that we will use for the continuous quality improvement of any EBP that we use, and a rigorous evaluation of the effectiveness of those services. And then also a training plan for each specific service that we intend to provide. Okay, next slide, Gail. So North Carolina has selected our evidence-based practices that we intend to implement. And you can see here the Home Builders Program is a well-supported program, and it is a program that provides intensive in-home skill building and support for families. The Parents as Teachers is also a well-supported prevention program that is an in-home parenting education program. And Triple P is supported, not well supported, but supported in the clearinghouse intervention for families of children with moderate to severe behavior problems. So Triple P focuses more on parents who are having real difficulties maintaining their children in the home due to the children's behaviors rather than abuse and neglect. The EBPs that have been chosen that are funded by Medicaid are MST, and that's intensive treatment for youth delivered in the community. So in this case, MST would be a prevention service where the child would go to a therapist in the community and receive therapy, and that would be paid for by Medicaid, but it would be considered a prevention program. And then also the methadone maintenance therapy. And this is specifically designed to help families whose children are at risk of foster care because they are having drug abuse issues that could bring their children into foster care. One of the drug abuse, as I'm sure you guys know, is one of the main causes for children to enter foster care in North Carolina. Okay, next slide, Gail. So our statewide implementation of the prevention services, the EBPs, will begin as a regional service delivery, focusing on meeting the needs of the families and children within their community. The EBP sites per region will be based on the projection of need for each intervention. And those again will be regional projections of need. The early EBP implementation will focus on home visit models, those home visit models that I just talked about in the previous slide. The division will execute the EBP contracts with providers and provide training for child welfare staff, the county workers who will actually be referring the families to the EBP, the prevention service providers. And then the purveyors, of the EBPs will train provider staff and provide fidelity monitoring. So they'll be responsible for training their staff that will be providing the service directly to the families. Next slide.
We just need to leave enough time at the end, Linda, for us to questions. They've got a gazillion questions for you.
Well, and I don't know what number slide we're on, Gail.
We're on 14 of 17. We're doing good. I just want to make sure we leave time.
Okay, sure. Yeah, definitely. So the phases of the EBP implementation will begin in the fall, as we said in the beginning. And with the first phase will be the rollout of the Home Builders Program, and we anticipate that will begin in the fall of 2021. And then Parents as Teachers is anticipated to begin statewide in implementation in January of 2022. Triple P is anticipated to begin in late 2022. And then we will implement the eligibility for the prevention services under Medicaid, MST, and methadone maintenance. Those things are currently available as a state-funded service, but we anticipate working on implementing them in the next phases of the FFPSA rollout. And our timeline, again, for the prevention services, as you can see, the first part of this timeline, we're pretty much all the way through April through June, working on the refinement of the prevention plan, and we've been working hard on that. Contracting for the prevention services, the ongoing continuum of congregate care work, and that is a main focus of our work moving forward from June into October. Conducting policy review and practice analysis, and then developing the rollout plan and beginning implementation. We plan to submit the prevention plan to our federal partners, the ACF, in July, and then refining and the continuum of care and congregate care work. Also from July moving into October. So here we are, and hopefully those of you that were with me at the beginning recognize this slide. So we have now moved from the beginning almost to the end, and now we're back at the FFPSA takeaways. I had a great professor one time that told me in public speaking, you should always tell people what you're going to tell them at the beginning and then tell them again at the end. So the FFPSA takeaways are in October 2021. Again, FFPSA kicks in October 1st, 2021, whether we're ready for it or not. This is the deadline for the federal law to take place. Again, the allocated funds are changing to incentivize prevention of entry of children into the foster care system, and to de-incentivize placement of children in congregate care and allow for more placement of children with families. And this system change, again, takes time and is complicated and complex, and includes all these steps and all the steps that I just droned on talking to you all about for the last 40 minutes. Next slide, Gail.
Okay. Here we go.
And here we are at the Q&A.
All right, so let me ask the questions, and then we'll just go and let you go from there. So does the safety design team include stakeholders and community reps, or just state staff?
The safety design team and all of our design teams are made up of people from all of those things, all of those places that you just mentioned. There are some state staff on the safety design teams, but the majority of the the design teams, not just safety, are stakeholders. Some from our partnering agencies, some are from county DSS, some are, we have representatives from our family partners. Our family partners are families who have been, have either their family members or themselves have been part of the child welfare system. I know that there are a couple of foster families that are present, that are on the design teams, as well as adoptive families and kinship families. So we have, I think, a pretty well-rounded representation on the design teams from all different parts of the child welfare system.
Okay. Next question is, will there be a timeline given to preserve the family before entering foster care? And so we were talking about, at that time, was talking about the services being entered earlier and more prevention services put in. So that's where that question came from.
Oh, I'm going to answer the question in the way that I think it's meant, and then if I get it wrong, then whoever asked the question can just let you know, Gail, that I did not answer the question. So what I think you're asking is there a timeline that sort of mimics the timeline for permanency? So we all know timeline for permanency is we strive for children to receive a permanent status, a permanent home within 12 months. But with regard to prevention services, no, there is not there's not like an expiration date on prevention services. The preventive services will be provided to families and for families for as long as it takes for them to either the factors that created the situation where a child could be removed from the home and placed in foster care, for those factors to be mitigated, so that, let's say, a parent needs to go to receive treatment for an alcohol or drug addiction, and the process might take, for some people, 30 days, for some people 6 months, for some people 12 months. So no, there's not a specific timeline for prevention services, but I will say that throughout the life of a preventive case, there's constant oversight and evaluation of whether or not the children remain safe at home. So if at any time a child was deemed to not be safe in their home when prevention services are being provided, then Child Protective Services would take action to remove the child from the home. So I hope I answered the question that you asked, and if not, you can let Gail know.
No, I think it did. If
Okay.
not, so the next one is, can you please explain more about the Home Builders Program?
I sure can. I know a lot about the Home Builders Program. Actually, Home Builders was a program that when I was a line worker working in the field in child welfare, I got to go through Home Builders training, and some of my families that I worked with were some of the families that received the Home Builder services right off out of the gate when I was up in New York. Home Builders is a very intensive in-home family preservation program. And some of you may be familiar with the term and the title of family preservation and the family preservation program, in-home services program. And Home Builders is the actual official family preservation provider. North Carolina has used a version of the Home Builders program that has been called family preservation, but we have not been providing the actual Home Builders program that is that Home Builders is a proprietary program. It's owned by the group that that developed it, and in order to call your program Home Builders, you have to use that particular model. And in order for us to use the program for funds, we have to use the actual Home Builders program. So all of that to say, very, very intensive. The people who provide Home Builders program work with 2, maybe 3 families at a time. And they are visiting their families sometimes daily in their homes to work with them on very, very specific issues that run the gamut from not being able to appropriately care for their children and discipline them, to helping them to learn how to maintain a home that is not a danger. The home itself is not a danger to the children that live there. So it's very, very intensive, and it can be any number of things that the Home Builders specialist, and I'm not sure what they're actually going to be called, but the people that actually go into the home and provide the service will be working with the family pretty much daily.
All right, the next one, and I think you cleared this up, but let me go ahead and ask it. Are the selected EBPs privately run program or state-run program?
Yes, they are privately run. The state will contract with the providers of the EBPs, and but the providers are private, like the private agencies. Some of you licensed with private agencies may be the private agency may be a purveyor of one of the prevention services.
All right. The next one is, I'm going to read through all the comments. Any plans to increase providers of the services? Most don't take Medicaid, and those that do typically have crazy long wait lists.
So yeah, I mean, what we're trying to do right now, not trying to, but we are working really hard right now to partner with Medicaid and with the mental health division within the Department of Health and Human Services in order to ensure better provision of services for children and families, particularly those who are identified as needing services through the child welfare system. And our hope also is that the Medicaid reform is going to make a difference in that. There is a carve out for children receiving foster care. And I noted, Gail, that there was I can't remember where I saw it, but I saw a note about there being interest and questions from your group about the Medicaid reform.
Yeah.
And how that Medicaid reform is part of the crosswalks with the child welfare
Yep.
system and foster care. And I'm going to talk with you offline about the person that I work with in the child welfare section, who's very involved in all of that. And I think maybe you could set up a time for her to come and do a webinar with your group.
Is it Christy?
No, it's Heather. Yeah, Heather.
Okay.
All right, next question.
Is there a set window or never mind, that one's been asked. Will there be any standards to put in place for MMTs to be sure that they aren't making any money off selling methadone to clients and are truly providing services to help families learn to cope without drugs?
Well, part of the whole, part of the requirement for the Family First Prevention Services Act is a very rigorous and intentional evaluation of every one of the prevention services. So with that said, yes, I mean, in as much as people can, have oversight of those kinds of goings on. I mean, is it possible that someone would sell the methadone? Yes. Will we have oversight to try to prevent that? Yes.
Okay. This next one is a great question. What is the criteria for decision making and getting CPS involved immediately versus this route of EBP family services? Has the criteria for removing a child from the home changed? That's a loaded one.
Yeah, that is a really, really good question. And I didn't spend very much time talking about what makes a child a candidate for prevention services. There is a very specific definition for what makes a child a candidate for these prevention services. And that candidacy means that without these prevention services, the child would be removed to foster care. Now, does that mean that all children that might otherwise go to foster care will not go to foster care and instead receive these services to try to keep them at home? No, there will be circumstances where children have to go to foster care and prevention services will not be the right intervention. Every case is different. And that's going to be up to the Child Protective Services investigator. All of these families that receive these services will be involved in the child welfare system as a result of a Child Protective Services report. Yeah. So the report is made and then the investigator will make the determination about whether or not the family can be kept intact with prevention services with these high-level preventive services, or whether children need to be removed to foster care, or whether the report is not substantiated. There's all different levels and different degrees of determinations in a Child Protective Services case.
So let's go back to the MMTs. So basically what the questioner is saying is seeing providers that only give the drugs to clients and not provide any effective therapy. And I've seen that too here in Buncombe County. So they're basically exchanging street drugs for legal drugs. And so I think there's a concern that, we get quality providers, and that's been brought up again, as quality providers in these positions and not just any provider. Yeah,
and I'm not going to, I'm not an expert on the methadone maintenance program, and I'm not going to pretend to be one. And I don't want to answer that question
Mhm.
inaccurately, and to say that, that's not how the methadone maintenance program works, because honestly, I can't say that with any degree of certainty. Some things I can talk about very, with a lot of certainty, and this is not one of them. But I will say again that every one of the programs that we implement and that are paid for, and that we have any role in with regard to it being a preventive service where the families are receiving this service specifically to maintain their children in their home, there's going to be a lot of oversight over those programs. And
Okay.
I can say that also any program that involves federal funds, where we receive federal funds as a state, and then we provide those federal funds to other service providers, we are audited all the time, and we have to show proof that we have done our due diligence to make sure that those dollars are being spent on programs that are actually helping families, helping children, and not and that they are receiving, that we're getting the results that we're looking for.
Right.
So there's a lot of oversight. Um, and but again, as far as that particular program, I can't speak to exactly what the program entails.
Okay. So I've got one comment and then one question, because we are making sure that our foster families are very educated. The first is a comment. This seems very time consuming for workers to monitor the family for success, and hats off to those taking on these services. So that's the comment. And then Lindsay, thank you for bringing this up. I no doubt knew it was going to come up. We made sure that we put this out today. But will North Carolina, and Linda, I don't expect for you to come right out with an answer tonight, but that was on my agenda to reach out to you. And you are the person, since you're all about this. Will North Carolina be contracting with agencies that discriminate against LGBTQ families, referring to the Supreme Court case just ruled on today, Philly versus Catholic Services? I would hope that those new opportunities, the state would not be contracting with organizations who discriminate like this. This is detrimental to families and to kids who could be entering the foster care system. And thinking of the fact that I know of at least 2 girls that are staying in the DSS tonight because they don't have a home to go into, and we're telling families no. So I don't expect you to give an answer tonight, but at some point, I'm going to be knocking on your door on that one, where North Carolina stands on that.
Yeah, and Gail, I would ask you to copy that question,
Yep.
and send that question directly to me in an email, so I can have a discussion about that up the chain
Yep.
with my administration.
Yep. I will do that, and Lindsay, be expecting a response to that, and I know how to get a hold of you. And as always, we appreciate our speakers coming, and Linda Waite. Those of you that don't know, she's the one that signs our check for us to be standing here as an organization on behalf of all the foster families and resource families and across North Carolina. So she is our go-to person. We appreciate you coming tonight, Linda, and answering all these questions. And as always, you guys make sure that any chance you get, send questions our way, because one of the unique things that we have, like you just saw, Lindsay asked that question, I asked Linda, and she said, I'll take it straight up. And when she says she's going to take it straight up, she's going to take it straight up. And you wouldn't believe, I don't always get the answer like immediately, but I can promise you we get them back. And you know, this is information that's going to definitely impact us, and we're super excited to hear that. It's 8 o'clock. I am very punctual, and you guys have babies to love on and all of that. And if anyone wants to stay back and chat, you're welcome to do that for about 15 minutes, and then I've got a baby to go put to bed. And I'm going to stop recording, and you guys have an amazing night. Thank you.
Thanks, everybody. It's good to be with you.
Thanks.